Steve Adubato. More importantly, the doctor is in the house, one of my favorite doctors here in the studio. Dr. Michael Kelly, Chairman, Department of Orthopaedic Surgery, Hackensack University Medical Center. Good to see you, Doctor.
Good to see you. Always a pleasure.
Every time I see you here or over at Hackensack, I find out something new because I'm always finding out about what's happening in the field. And the field's changing dramatically. Let's talk about one of the areas we talked about is hip and knee replacements. Changed dramatically just in the last time we talked a few years ago, right?
Yes.
Some of the biggest developments are.
Well, it's ever changing. I think the biggest developments are we continue to look for knees that are going to be able to tolerate increased wear and activity that our patients want to do. And we're seeing developments that marry the clinical research and the scientific research into better implants and better postoperative recoveries.
People expect more. I mean, one of the things that we always talk about when you and I get into this is that people don't want to simply, you said before we got on the air, they don't want to simply walk up the stairs with the new knee. They want to do what?
Well, they want to do what they were doing before the pain started. So they want to be active athletically, they want to be active socially, they want to continue to do things like skiing and playing tennis. And the component of this is they don't want to do it without pain. You know, years ago, these weren't the expectations. They were just happy to be pain-free and to be able to do their everyday life. But that's not happening now. You know, the largest growing and fastest growing population we have is between 45 and 60 years old.
Not older.
No.
It's 45 to 65.
Well, I would say
60 or 65.
I would say the fastest growing part is between 50 and 60 years old.
Okay.
And these are people we used to put off for many years, but the long-term results of total knee replacements are emerging that would suggest we can do knee replacements and hip replacements in this young age group.
Why is it now more acceptable to do that where it wasn't 15 years ago?
Well, 15 years ago, we were lucky if we had 10-year follow-up, and everybody in that age group was usually in their mid-60s. You know, our group in the city, we've actually published a 20-year follow-up on patients under the age of 55, where we're seeing roughly 85% of those knees still working. So while we used to ask you to wait till 60, basically give up your lifestyle for 4 or 5 years while you were in pain, no longer do we do that. You know, if it's an appropriate thing and you have the appropriate expectations, then we'll go ahead with it.
Because you're an athlete, and by the way, give people a context of your athletic endeavors, and then I'll bring in the rehab part, which is huge. Go ahead.
Well, I have been an athlete all my life, playing football, basketball, and tennis in high school, and continuing more recently in triathlons where you swim, you bike, you run. And so this has been a big part of my life, and I think a critical part of my life for many, many years. You
also use that experience when consulting with patients, do you not? Particularly those who are very concerned about being athletic and being active. Correct?
I think it's one of the things that attracts many of my patients to me. They've heard of my background. They know that I'm not there just to treat their pain, but to return them to their active lifestyle. And I think they get some sense that I'm interested in doing that for them.
The persona knee, what is it? Because it's very personalized as I read about it, and I can't figure out, as you talk about it, Doctor, whether it's on the market, and if it is, who is it's on the market to? Like, who is it available to?
So the Persona knee is a new design in knee replacement that has married some of the wonderful features of previous designs that we've documented through the years, and attempted to bring in the world of emerging technology and science to more personalize this replacement for the individual patient. What does that mean? Well, we are able to go and look at large volumes of bone anatomy, not just in the United States, but worldwide. So Indian bones, patients from Korea, you know, Middle East, which allows us to have the morphology or the shape and the size that can more accurately reproduce the anatomy of the individual patient. We think that that will improve their function and perhaps improve their expectations and results.
Who is it on the market to? As we speak, we're doing this program as you get into February of 2013, and we'll repeat after that. Is it on the mass, if you will, market?
So This design has been available to the individuals who are involved in the design process, and then another level of very busy surgeons up to date as we approach February. It will be now on the market throughout the United States and perhaps Europe in the next month, and available to surgeons worldwide over the next year.
Doctor, let's talk about younger people, younger people who wind up having orthopedic problems earlier that we haven't seen before, or maybe we're not diagnosed the way they're being diagnosed today. First of all, why is this happening so often? And B, what about the recovery time and how quickly these athletes are coming back?
So I would say this is the most distressing part of my own practice. One of the reasons we're seeing such an elevation in the incidence of these injuries is because, 15 years ago, women were not playing sports at the same pace as men. Fifth graders down to kindergartners weren't in organized sports. They might play Little League baseball, but now from the minute they're in the first grade, they're playing organized sports. They're playing them 12 months a year. Women are playing them every bit as much as men, and they seem to be more prone, let's say, for knee injuries. We know they're much more prone to ACL injuries.
Okay, you've said this is an epidemic. What does that mean?
An epidemic is a word.
How bad is it?
It's bad. It's very bad, and it's very distressing to me as both a father and a surgeon, because we're seeing a number of these kids in high school. They're playing 12 months a year. The kids are bigger, they're stronger. We're seeing now these NFL players who've been injured looking back and saying, would they let their own kids play this now they know what they know? And many of them are saying no. And so when we see these injuries, the first thing the kid and the parents say is, when can we get back?
What should the question be?
The question is, when can we come back safely? When can we come back when we're fully rehabilitated? And what are the risks of further injury as we go back to these sports? People are so involved in trying to utilize sports in this very stressful world of getting into college that it has, I think, done some difficult, has posed some difficult problems in the decision making both for the injured athlete and their parents.
Finally, advice to parents right now about this particular very serious problem. What would you say to parents right now who say, hey, I just want my kid in there. Want them back in the game. Go ahead.
Well, I think that don't underestimate what's happened to their body with these injuries, whether it be concussions, knee injuries, foot injuries. This isn't like a car where you can put new parts in and it'll be just good as new 30, 40 years from now. And I am very concerned that when we see this generation of athletes approaching our age, there's going to be real problems.
It's important advice, Dr. Michael Kelly, as always. We appreciate it.
My
Thank you
pleasure.
very much. Stay with us. Important information always right here on One on One. We'll be right back right after this. Thank you, Doc.
One on One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One on One with Steve Adubato has been provided by Investors Bank, COHNØREZNICK, providing accounting, tax, and advisory services for more than 90 years. The Russell Berry Foundation, Fedway Associates, Inc., PSEG, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons, P.C., and by HealthFirst New Jersey. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey, and by NJBIZ, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One on One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.